Hi, this is Congressman Joe Courtney. I'm speaking to you from my office in Washington, D.C. Today, the House is about to take its biggest vote of this Congress, which is on a budget reconciliation bill. This is a mechanism which will set the parameters of taxes and spending over the next 10 years, and which will then allow the United States Senate to pass funding measures with only 51 votes. So that obviously is different than the normal process in the Senate. So again, what happens here in the House today, which the plan according to the Speaker is to start the process, is huge. So this chart shows really what's included in the bill. The top half of this chart shows the impact on the budget deficit, which is already way too big. The bill will add deficit spending because it extends the tax cuts from 2017 for the next 10 years. And we know from long experience and analysis, over 80% of that tax law went to the top 1% of this country, completely imbalanced and out of whack. There's some additional expenditures that are included of a relatively modest amount over the next 10 years. The lower part of this chart shows the cuts or the offsets that the Republican majority plans to implement to offset some of the incredible magnitude of the deficit additions that is included in this law. And again, when you do the math between what's adding to the deficit and what's reducing the deficit down here, you still end up with a net increase to the federal deficit. This is not a deficit neutral bill. This adds to the deficit, despite the president's claims that it reduces the deficit to zero. In fact, the opposite is true. The biggest ticket item that has been proposed to reduce the cost of this bill is to cut $880 billion out of the Medicaid program. Again, this is the largest healthcare program in America. It's bigger than Medicare. It's bigger than private health insurance in terms of as a single plan that covers Americans. In the state of Connecticut, it generates about $5 billion that goes into our healthcare system totally. Some people think, well, it's just for people who don't want to work. The fact of the matter is it covers a wide range of populations, almost 800,000 people in the state of Connecticut, including individuals in nursing homes, other seniors who are on Medicare that are dual eligible. It's actually about 25% of Medicare beneficiaries in the state of Connecticut. Provides coverage for live births in the state of Connecticut, 41%. Again, our Medicaid funded births, and we obviously want to make sure that the delivery of new babies is done safely and is as pro-life a measure as you could think of, honestly. And again, adults with disabilities, adults aged between the age of 19 and 64, many of whom are working and who are eligible through Medicaid help in the Affordable Care Act. So that type of hit, which is about 20% of the cost of the program, means that in the state of Connecticut, we are going to see serious fallout in terms of hospitals who receive roughly about $3 billion out of that $5 billion, nursing homes, which is roughly $1 billion, and individuals who make up the rest. Again, right now, our healthcare system is strained to the breaking point. And you talk to anybody in the system, they will tell you that. This is not a good plan for not just Connecticut, but frankly for the healthcare system all across our country. There's a better way for us to set up a system to make sure that tax assistance for low income and middle income Americans is protected from a cliff that's coming later this year. It's not to give the top 1% who gets the majority of that tax cut a benefit that they just don't need. They're doing fine. And what we also need to understand is that there's critical services that the federal government through Medicaid provides for our state's healthcare systems and patients that really should not be offered on the altar of sacrifice to satisfy a bunch of billionaires who really have been working on this measure for the last 2 months after the election down in Mar-a-Lago. So I will be voting no. It's going to be a close vote. And I think, again, I wanted to just take a moment to explain my reasons why. There's a better way to do this, but it's not by gutting the Medicaid system and really giving the benefit of that to the top 1% and adding to the deficit. That's a bill that should be rejected right out of hand, and we should go back and to the drawing board and come up with a better measure. Thank you for listening, and if you have any questions, please contact my office.